Hydrotherapy can immensely impact the immune system through a variety of different applications, but one of the most powerful, effective, and simplest ways of using water to increase immune system function for the sake of prevention and treatment of disease is a contrast shower. A contrast shower is exactly how it sounds, contrasting between hot and cold water. For best results, shower with the hottest water you can tolerate, thoroughly heating up your body for at least 3 minutes, and then switch quickly to the cold for at least 30 seconds to a minute, rotating around in the cold, exposing your whole body to the cold. As you progress in the treatment, try to increase the temperature difference between the hot and cold. This will make the treatment or the contrast more pronounced and effective. The treatment stimulates circulation by vasodilation during the hot phase and vasoconstriction during the cold phase. A contrast stimulates the nervous system, and daily brief cold exposure can increase both the number and activity of peripheral cytotoxic T lymphocytes and natural killer cells. These are both major effectors of the adaptive and innate immune system. So brief cold exposure increases immune activity. Why would we want to increase immune system function? Well, the main tasks of the body's immune system are to fight disease-causing germs, pathogens, like bacteria, viruses, parasites, or fungi, and to remove them from the body, to recognize and neutralize harmful substances from the internal environment, and to fight disease-causing changes in the body, such as cancer cells and other growths. The immune system can be activated by many different things that the body doesn't recognize as its own, or they're not supposed to be there. These are called antigens. Examples of antigens include the proteins on the surfaces of bacteria, fungi, or viruses. When these antigens attach to specific or special receptors on an immune cell, a whole series of processes are triggered in the body to neutralize and eradicate that particular antigen. Once the body has come into contact with a disease-causing germ for the first time, it usually stores the information about the antigen and how to fight it. Then, if it comes into contact with that specific antigen again, it recognizes the germ straight away and has specific antibodies ready to handle the attack. There are two subsystems within the immune system, known as the innate immune system and the adaptive immune system. Both of these subsystems are closely linked and work together whenever a germ or harmful substance triggers an immune response. The innate immune system provides general defense against harmful germs and substances, so it's also called the non-specific immune system. It mostly fights using immune cells such as natural killer cells and phagocytes. The main job of the innate immune system is to fight harmful substances and germs that enter the body, for instance through the skin, the respiratory tract, or the digestive system. The adaptive immune system makes antibodies and uses them to fight specific antigens that the body has previously come in contact with. This is also known as an acquired or learned or specific immune response. Because the adaptive immune system is constantly learning and adapting, the body can also fight bacteria or viruses that change over time. So increasing and stimulating immune system function has far-reaching effects on maintaining health and preventing disease, especially infectious ones. The determining factors that affect whether an individual succumbs to a certain harmful virus or bacterial infection are the strength of the immune system, exposure intensity and frequency, and in some cases, genetic factors. So let's do all we can to increase immune system function by eating lots of whole fruits, vegetables, and grains while exercising regularly. Hydrotherapy is one of the few ways we can externally significantly augment the function of our immune system. And here's how. After subsequent cold exposure, we see an increase in immune system function, specifically in leukocytes, granulocytes, circulating levels of interleukin-6, and as a consequence, increased levels of interleukin-10, and also natural killer cells. Leukocytes and granulocytes and monocytes responses were augmented or increased during pre-treatment with exercise and water, cold water that is. And thus acute cold exposure has immune stimulating effects, especially when combined with exercise. Exposure to cold is also known to activate the sympathetic nervous system and increase blood levels of beta-endorphin and noradrenaline, and to increase synaptic release of noradrenaline in the brain. Additionally, due to the high density of cold receptors in the skin, a cold shower is expected to send an overwhelming amount of electrical impulses from the peripheral nerve endings to the brain, which results in an antidepressive effect. The endothelium, the cell layers that line the inside of the blood vessels, secrete substances that regulate blood vessel dilation and constriction, such as nitric oxide synthase. The blood vessel activity improves cardiac function. Endothelial dysfunction is characterized by a decreased secretion of vasodilators or an increased secretion of vasoconstrictors. The exchange between hot and cold manipulates the endothelium, causing it to secrete more vasodilators, which increases vascular compliance. So, as we can see, the simple, non-invasive, immune-stimulating contrast shower provides a variety of benefits through several different mechanisms. This preventative treatment can be easily applied to one's morning routine. Don't worry about having time for exactly 7 exchanges. Just do what you can in the time that you have. And remember, end on cold. Happy Hydro!